Hello doctors! To know how reliable our neural network assistant is, we use several metrics. Accuracy is the percentage of correct predictions out of all cases. If a neural network correctly diagnoses 90 out of 100 images, the accuracy is 90%. Sensitivity, recall or true positive rate, is the ability to correctly identify patients who have the disease. Out of 50 actual pneumonia cases, if it correctly identifies 45, the sensitivity is 90%. High sensitivity means it's good at detecting the disease and doesn't miss sick patients. Specificity, true negative rate, is the ability to correctly identify patients who do not have the disease. Example, out of 50 healthy patients, if it correctly identifies 45, the specificity is 90%. High specificity means it doesn't falsely label healthy patients as sick. Precision, positive predictive value, is the proportion of positive identifications that were actually correct. Example, if it predicts 50 patients have pneumonia but only 45 actually do, the precision is 90%. High precision means when it says a patient is sick, it's likely correct. AUC, area under the receiver operating characteristic curve, is a measure of the neural network's ability to distinguish between classes across all thresholds. Example, an AUC close to 1 indicates excellent performance. It gives an overall sense of how well the model can separate sick from healthy patients. Accuracy is often the most discussed metric because it is easy to understand, but it is not always the most relevant. In some cases, you might prioritize a system that never misses a sick patient, even if it occasionally labels a healthy patient as sick. This trade-off is acceptable when missing a diagnosis could have severe consequences. However, in other situations, falsely labeling patients as sick can overburden healthcare systems and subject patients to unnecessary tests and stress. Therefore, evaluating a model's performance requires more than just assessing its accuracy. It involves carefully considering whether the model is safe, efficient, and appropriate for the specific clinical use. Learning about AI in medicine is a journey one you can start now by subscribing to this channel. I hope you found this video helpful. Thank you for watching and see you in next videos.